We're going to run through some pretty exciting feature updates today. So just really excited about where we've come in the last quarter and some of the upcoming items on our product roadmap. This is the agenda that we have for this quarterly update. We talked through the vision for the product, what SyncTimes is, what we aim to be, and what we aim to become, how we're evolving the product and evolving the system. We talked about new functionality that we've added in the last quarter, as well as the roadmap, what we plan to do short term in the next quarter, as well as longer term over the next couple of years. And then we also like to just review requests, talk with each of you about any requests and ideas that you have to help improve the system. So with that, we're going to jump in. I'm going to skip a few here and just jump straight to the agenda. So 4 big items that we're talking about today. The first one is actionable patient surveys. The second is having some additional patient content that is available on the screens, including videos. Third, we've been working a little bit on deployment options for the system, making it easier to deploy, especially around using wireless internet and not having to pull as many Ethernet cables. And then last, talking about some additional options for Athena Health practices and some things that they can access through the system. So without further ado, we're going to talk a little bit about surveys. We just like to kind of highlight what are the challenges that we're hearing from our health centers before we dig into what the new feature looks like. So this is what really triggered us to build additional functionality around surveys. Some of the challenges that we heard, obviously, not a lot of responses from patients. When you send the data out, often you don't get the survey responses back in sufficient time to really do something about it. When I get survey questions from my healthcare provider, it comes in a letter. I get that letter and I'm supposed to fill in the bubbles and then I send it back. Usually when it gets back to the health center, it's been a month and it then goes to a committee. It sometimes dies in that committee. It doesn't really make it to the care teams and, change isn't able to happen from that. A lot of different systems to manage, and sometimes it's complicated for patients to fill that out. They have to dedicate some time to doing that. With some of the objectives that we wanted to set out to do, obviously improving the response rate. We have beta tested this functionality with some health centers. We've had a 25% response rate historically to the first question, which is just that simple. Are you happy with your service? And then we've also had more free response questions now that have had about a 14% response rate. So we've had good response rates, both to just categorical, really easy questions that are, are you happy with your care, as well as a lot of patients that are responding to more free response questions. Tell me about your visit today. Tell me about your care team. What has made your visit exceptional today? Those types of questions. The second, we wanted to get this data out to the care teams quickly. We wanted to tie the data back to the patient experience for reporting. We want to take the good feedback and use it to give some kudos to the care teams, as well as make it really simple to administer. And so I'm just going to walk through a demo here of what that would look like. This is a tablet. So this would be a tablet inside the room. While the patient is alone in the room, they would see this pop up. And there's 2 options. They can either just fill this out here with the question being, how's your visit been today? Or they can scan these QR codes and they can do this on their phone. So it's really up to the patient which of those options they prefer. For this example, we'll say patient's happy. And so they're going to select the smiley face. And then we added just a next button here. We had patients that were accidentally hitting the unhappy face. So now they have to say, yes, I'm happy. And then they have to hit next to confirm that. So they hit next. This is what you would see then on the flow station. So just kind of fun. You see the smiley face pop up and then you get the confetti. So this is just kind of a kudos to the team that's just showing, hey, there's good feedback in exam 3. And then the patient is going to be taken next to really any other question that you guys want to ask. And you can start with a different question as well. You can start with a different format of question, multiple choice or free text. But usually we find it's best to start with just that simple smiley, and then you can dig in if you have other questions that you want to ask after that. So in this example, the question is just, what else would you like to share? On the tablet, the patient can type whatever their feedback is and then hit submit. And then it just says, thanks for taking our survey. Again, you can have more questions after that, or you can have, multiple choice, different formats of questions. But that's kind of the walkthrough, and this would all be on the tablet, or the patient could do it on their phone. If we go back to the flow station view, this is again just giving some congratulations to the team. What we're doing on the back end is we're taking that text and we're kind of running it through some artificial intelligence to say, is this a happy response that this patient has left, or is this a grumpy response? And if it's a happy response, what we're putting on the flow station, so for that department, they're going to see congrats, and then the provider or whoever's assigned to that room on a happy patient with the quote that the patient left. And so I love my care team is just an example. What we've seen in the last couple of months as we beta tested this is the overwhelming majority of patient feedback that we get here is very positive. And so we want to just send that out to the team in a way that's meaningful and can kind of celebrate the wins and get them a little bit of kudos, a little pat on the back. I want to talk a little bit about now what happens on the back end with that data. First off, we're tying that data to the patient visit. And so the feedback that you get, say if you have a patient who says, hey, I had a long wait, what you can actually do is drill in on the reporting and see exactly how long that visit was, who visited them, how long the patient was waiting throughout the course of their visit, as well as any other feedback that they left through survey responses. So here you're seeing this patient's MRN, you're seeing their survey responses, and then you would see here who visited them, how long, what their wait times were, et cetera. This is just through the typical patient history report that this is all visible. And then we built in a new report that is showing the responses to these surveys. This is an example from Kinixu Health in Sandpoint, Idaho. We asked them if we could share this just because it gave a great overview of some of the kind of awesome feedback that they've received from their teams. It looks a lot like our other reports where you have your organization, you have your filters here, and then you can see on this table, the department, the staff that visited that patient, what the question was, and then what the response was. So just some nice feedback, some that's really basic, extremely good. Here's one, she's the best doctor I've ever had. She listens to your concerns, has a big heart, lets you know that you're special. She gives you her full attention, truly cares about you and your well-being. So there's kind of a cool set of data that we get around just really positive kudos, but then also some suggestions, things that patients will say, hey, it would be nice if we had this adjustment to the care delivery that we receive. And so this is just to give you an idea of some of that reporting. I want to show real quick, there's an option at the top right, there's 3 dots that you can click, then you can say, I need to export this data. You can export it with the current, you want to select export with current layout. And then when you export, it'll just be an Excel spreadsheet that shows all that data, the time, who visited the patient, and the department. So this is just a quick overview of what that survey will look like, how you can export it. There's also an option for any staff that you have that are really managing the patient experience, or clinic managers that are really directly involved with the patient experience. There's an additional option here to receive an email on a daily basis that shows any feedback that you received the prior day. What that'll do is give you a summary overall, and then it'll break it down by department. And so here's the summary you had 22 responses to the first question. Of those, 17 were happy, 3 were neutral, 2 were sad. And those are the smiley faces. And then these were the more broad feedback that was received during this day. That's an email that comes at 5 a.m. Mountain for the prior day. So in the morning, you just have the summary from the prior day. The way that's set up is in your on the user profile. You just need to add the permission to receive a patient survey digest email, and then that will be sent to the appropriate teams. Real quick, this is just the steps to implement, if you'd like to implement these surveys in your health center. First, we just connect with the SyncTimes team to enable those. So just connect with our team and we can turn those on. We typically also want to work with you as far as what is actually shown on those and what the questions are. We have some best practices that we've learned as we've worked with some different health centers on how those questions can flow most effectively. And then second, we may need to swap out USB receivers on the tablets if you're using free text questions. And that's just because those receivers right now are not compatible with the free text questions. They kind of serve as a keyboard, and it prevents the free text questions from working properly. So that's something that we may just need to swap out if you're looking to implement that, and have been installed for over about a year, give or take. Real quick, just want to take a second. Any questions on surveys before we move forward here? Awesome. And next, I want to jump forward, talk about patient content options. What we mean by patient content is anything that you want to show the patient on the tablets. And so obviously surveys is going to be one option. Another option that most are already using is having some slides for education. So some Google slides that are just running through different content that's educational or promotional to help patients know what's coming. New in the health center, maybe some new services that are available or a new provider. We also have added this quarter the option to show videos. And so if you'd like to have a video show for the patient, that's an option now. A couple of ideas behind this. First, we wanted to take some of that time that we know patients spend alone. We have a lot of data to show patients spend on average between 12 and 15 minutes waiting for their provider after the MA has left. So the thought is, why don't we take some of that time that is really wasted, the time the patient's alone, and make it value add through, a dedicated screen that we already have in the exam room. So that's the idea here. A couple of ways health centers are using this. First, just having a video that pops up and says, hey, we'd love for you to take your survey on this screen. So increasing the responsiveness to those surveys. Second is having some educational materials. One of the pieces that we're looking to build out is having that tied to any quality gaps that the patient has. So if they're due for some sort of care, having the video actually be tied to the items that they're due for. Third, we have some health centers that are using this for recruiting. And so saying we need, to hire some CMAs, we need to hire some dental assistants, being able to have just a promotional video to highlight the benefits of working with your health center. And then last, for marketing additional services, we have a pharmacy that you may not be aware of. We have behavioral health services that you may not be aware of. Just to give an idea for what that looks like, there's really two options for how this is shown. The first is that you will see it just pop up automatically when you're alone in the room as a patient. And the second option is staff can manually select. There's a new icon that you'll see in the bottom of the tablets. This is just an example that Kinixu made to invite patients to do some surveys. Just a cute little video. You're not hearing any sound right now, but it's just saying, hey, we'd love for you to take a survey to give us some feedback. Your feedback helps us to improve our patient care. This down at the bottom, this resources button is what you can select if you want to view a video while you're in the room. So if I'm a provider and I'm in a room with a patient, we have a video that I'd like to show them while I'm there, I can select that. It'll give me a pop-up of any videos that are available that my health center has made available through the tablets. And so you can select any of those videos. You can also have websites that are available there. So it's really any resources that you would like to make available for patients can be accessed through that resources button. As far as implementing this, step one is really having the video content available. And so whatever you would like to share, a lot of health centers already have a marketing team that's sharing videos through other channels, through social media. And so if you already have those, great. We just need an MP4 file. And then contact the SyncTimes team to enable those videos on the tablets. As far as the sound goes on these, there's been a number of questions about sound and how we do that with these tablets. There's a mute button that you'll see. So if you're looking at this video on the bottom right here, that is a mute button that's available to patients and to staff. And you can either default to have a video muted, or you can default to have the video playing sound. It's up to you which of those two things you'd like to do. And then a patient can easily turn the sound off or turn it on depending on their preference. So it's really easy for them to toggle sound on those tablets. Any questions on videos? Stopping for a second here. All right. Well, Kim's video's on and Kim's giving me thumbs up. So I'm assuming that all systems are go. Thanks, Kim. Next, for practices that are on Athena Health, one of the challenges with the Athena portal is it gives us access to certain identifiers. It doesn't give you, it doesn't give your administrative team access to certain IDs. As an example, patient location, so exam rooms. We have access to that identifier, but you have access to other information. And so what we did is we just kind of pulled that all into our system. If you go to the EHR mapping tab, you'll see an Athena Health logo if you have the administrative access to EHR mapping. And then selecting that, you're able to identify and just get a drop down with all of the patient locations, meaning exam rooms, all the departments, all the providers, just to make it a lot easier to map from Athena to SyncTimes. And so that's just making those IDs easier for you guys to access. We're cruising along here. Before I'm jumping into roadmap next, but before that, any other questions or feedback? Kim, looking at you, so.
I don't have any questions.
All right.
Explained it so well.
Great. Kim's also just really on top of it. So feel free, any other questions, go in the chat. I probably won't make everybody wait for questions anymore. So roadmap short term. So this is for Q2 of this upcoming year. These are the items that we're working on actively today. Some of them are already beta testing. The first one is population health integrations. So the idea here is that when a patient is roomed, we have icons that automatically come up, including a checklist that says these are the care gaps that are open for this patient. The challenge there is that a lot of population health tools provide this cool huddle report that in theory would be very helpful, but in practice doesn't always get used at the point of care. You see it in the morning, but then you forget about it. So the idea is that we have something that's already integrated into staff workflows. If we can get patients just in front of that huddle report, then that's going to be much more beneficial. And ideally, it's for the specific patient. So that's what we're doing, is having an icon that comes up, having a checklist that says these are the care gaps that are open for this patient, and then having the staff check those off as they visit them. The idea is making those just a lot easier to consume, and then also giving them at the right time and in the right place for staff to respond to those care gaps. Second, talking through appointment statuses report. And so the idea here is that you, in your EHR, typically an appointment will have a given status, and then we're receiving updates from your EHR of any changes to that status. And so an example would be confirmation, cancellations, no-shows, patient has arrived. So we're building in reporting to take all of that data and to measure what percentage of our patients have confirmed. Of the patients that have confirmed, what percentage no-show? If a patient doesn't confirm, do they no-show, and at what rate? So those are kind of the pieces that we're looking to pull out of that status report, is having a good idea of what are the patients, the percentage of patients that have confirmed, what are our no-show rates, and how are those things correlated? And then also looking at other data tied to that, what percentage of cancellations are coming same day or within 24 hours, that type of data, and pulling that into the appointment statuses report. We have 2 health centers that are partnering with us to build this, and so we're really getting a lot of guidance from them. But this is something that's available as others are interested to provide feedback. It's something we're pretty excited about building in that data. And then third, we're working on building similar to what I showed earlier around surveys, where you can have a daily digest of the surveys. We're building an email that you can have where it's a daily digest of the data for your health center. And so taking the SyncTimes reports and being able to have just a snippet that says, hey, for this week, this is our performance. This is our alone time. This is our waiting time. This is our productivity over a given window. And so that's the third item that we're working on building out. As far as longer term, integrations is a big piece of what we're building out. So still focused heavily on integrations, building out things like population health integrations, and building those out more effectively so there's less overlap of kind of double entry happening between SyncTimes and your EHR. Next, expanding reporting, building it out based on the HL7 interfaces. We already talked a little bit about that appointment statuses, but being able to have a report that shows any likely no-shows, patients that have no-showed in the past that are due for their appointments and maybe haven't had a confirmation. So having a no-shows likely work list that can be followed up on. Also looking at just appointment utilization. So if a provider has 21 slots available, so 7 hours that they're seeing patients in 20-minute slots, how many of those appointments are utilized, and then how many of those appointments are actually filled. And that's the report that we're looking to build. We're calling it appointment utilization. I talked a little bit about at the start about simplifying the hardware deployment. So we have 3 health centers, 3 sites currently that are using a wireless deployment option where the tablets are connected via Wi-Fi, which makes it just a lot easier to deploy. We are just beta testing this, making sure that we have the support nailed down and have a good understanding of what is needed. We still do require a way of powering the devices, but in some settings, and dental operatories is an example of that, it's a lot easier to have power. You already have power in your dental operatories. And so it's really easy for us to pull power off of that. In a medical exam room, sometimes there's power nearby that's really easy to use. Other times it might be that the inside tablet, we don't need to do a drop, but we still need a drop for the external. So that's a work in progress that we're beta testing. So far, it's gone very well. But that's something that we're still actively testing. And then last, we're working on building out a users community, a forum where you can engage with other users of SyncTimes. Obviously, we have events like the summit. We have webinars that we're doing to help you guys collaborate and share ideas. But Ian and Lindsay and the client success team are working on building out really a community, a forum for users to engage, both with us on the team as well as with other users, and talking about how the data is being used. And so that is pretty much it. I've got kind of open for feedback here. I'll probably take off the screen share. First, just want to thank everybody for joining. If there's any questions, feel free to jump off mute and share or send them through